We're here today with Tara Foti from the Caucus on Family Violence Prevention.
Correct.
Yes, so welcome, Tara.
Thank you.
Tell us a bit about the caucus.
Sure, I'd be happy to. The Family Violence Prevention Caucus is a group of individuals who work in a variety of capacities, who are interested in addressing and preventing violence and dysfunction within the families. So we have a variety of backgrounds of people. So we have researchers, we have clinicians, people in practice working directly with families with a number of different interest areas ranging from sexual violence to physical violence, child abuse and neglect, and a number of other kind of household and community dysfunctions that impact the health and well-being of the family.
Tell us a bit about your caucus. How many members do you have?
Sure. So we've been keeping track of people who are interested in our caucus over the past decade or so. And on paper, we've got a good 2,000 to 3,000 members. But in terms of those who are meeting regularly and working to coordinate the affairs of the caucus, it's a core group of closer to 20 to 30 people. But our scientific sessions each year bring a number of people in practice and in research who contribute to the scientific growth of the caucus.
So Tara, tell us a bit about yourself and your own background.
Thank you. Well, I am currently a PhD candidate at the University of South Florida in Tampa, Florida, and I'm studying public health with a concentration in community and family health. And for my dissertation, I will be interviewing clinicians about their screening behaviors with pregnant women with opioid use disorder, looking at whether they screen both for opioid use and for commonly co-occurring conditions like intimate partner violence, sexually transmitted infections, and the like. And that's really in the hope that providers can identify this type of substance use and behaviors early on to ultimately get women the services that they need so that they can appropriately bond with their children and raise them in a more functional and supportive home environment.
Now, in the keynote address 2 days ago now, I think, in the opening session, the director of the Centers for Disease Control indicated that his biggest public health concern right now is the opioid epidemic. And his background as a doctor, he said he never thought he would be thinking about an epidemic that was not bacteriological or a virology oriented epidemic. How does the opioid epidemic affect patterns of family violence?
Well, certainly substance use itself is a set of behaviors that don't really lend themselves well to optimal functioning of a family, just because of the drug-seeking behaviors that people with addictions engage in. So children who are raised in a household with adults who are using or abusing substances, that's considered one of the adverse childhood experiences and is associated with poor outcomes. But in addition, families that use substance use often have other types of dysfunction or violence occurring at the same time, and may even be more likely to live in neighborhoods with higher levels of this type of violence and dysfunction and happening as well, both within the community and in the schools. So it's kind of a self-perpetuating cycle in that way.
Interesting. And is some of your research focused on this?
So my research is really focusing on the role of the provider in being able to identify the substance use early in the pregnancy, to kind of stop the pattern of babies being taken away from their mothers and impairing their bonding. So if we can get moms into treatment early, get them the help and the support and the services that they need and deserve in order to have their optimal health, then that promotes the optimal bonding and attachment between parent and child and can really set a family off on a trajectory of health instead of a trajectory of dysfunction.
So early detection for the purpose of prevention.
Absolutely.
The way to say it.
Yes.
Tell us about some of your scientific papers during this year's APHA.
The ones that I've attended or presented?
Well, the caucus.
The caucus.
Yeah.
Yeah, happy to. We've had some really great sessions with people sitting on the floors, standing room only. We're really excited to see the level of interest in the family violence prevention sessions. So we've had some great things on innovative interventions, on adverse childhood experiences, on intimate partner violence. Not specific to this year, but in the past we've had a number of sessions on human and sexual trafficking, which is an issue around the world that's gaining more attention. So the caucus itself is expanding a little bit beyond the scope of just exactly what's happening within the family to how do the things happening in the family also impact the community, and how does the community impact the functioning of the family as well. So we've had a real varied year of sessions that was really exciting to see and take part of.
And I know it's hard for our viewers to imagine, but of course it's a convention, and so this is a chance for public health professionals to have some fun. Do you have some dinners or parties that you and the other members of your caucus engage in?
Absolutely. So we have a really, business meetings might not sound like fun, but when you get a group of people together who typically see each other once a year, we do have a great time at our business meeting, and then we usually go out to dinner afterwards. And as a member of the University of South Florida, we have a great reception, as do a number of the universities here with the public health programs. And we've got the Reading Terminal Station right around the corner with lots of folks grabbing lunch and discussing their projects and their research together. So it's been great to be in a city that's so vibrant and has so many opportunities for people to get together.
Great. What would you say the most important issue for family violence prevention is at the moment?
I think that because family violence prevention encompasses a few different specific types of behavior and violence and abuse, that's a little bit difficult to say. But from my perspective, one of the main focuses that we need to keep having is how trauma from one generation perpetuates itself through violence and abuse and neglect to the next generation. And so I think that in order for us to help our children start out the best way possible and have the best health trajectory, we need to deal with the trauma and the abuse of their parents and what they're dealing with in their lives.
Very interesting what you're saying. There is a quote from a rather famous book that say the sins of the parent pass to the seventh generation. How does that generational kind of repetition of violence, how does that pass through, and what are the determinants of stopping that?
It's such a great and complex question. We probably could sit here for days and talk and debate about that. I think that we're learning a little bit about the epigenetics and how trauma and abuse can turn on and turn off different predispositions that we have genetically. We're learning about how the abuse and neglect and dysfunction that we're exposed to as children kind of sets up our relationships as adults and our expectations and our standards for ourselves and how other people treat us. And then without the focus and education and interventions, we just unknowingly repeat those same patterns again with our children. So there are a number of times that are very conducive to interventions, but essentially anything is helpful at any point in the spectrum, because a family is people who are related to each other, who love each other, who live in proximity to each other, varying ages, and everybody is a part of a family. So there are such a wide variety of things that we can do.
It's fascinating to hear that we are genetically programmed to respond to violence in certain ways, and that gets switched on at a young age with family violence. How do you manage that as somebody becomes an adult and essentially turn off that programming?
Sure. I mean, I think we have a long way to go with our understanding of these epigenetics and exactly kind of what our environmental triggers are, and then what to do about that. But programmatically, I think we need to bring to the forefront the importance of understanding our traumas and how to address them, and that without a focus and a concerted effort, that we just kind of innately fall back into the patterns of what we're accustomed to.
Very fascinating. So where do you see the caucus going in the next 10 years?
Well, next year in specific, the focus of APHA will be violence-oriented. So we're hoping to collaborate with a number of sections and caucuses to sponsor joint sessions, to put together a pre-conference session. Moving forward, as I mentioned, we have a large number of people who contribute to the scientific sessions, who've indicated interest in the caucus in the past, but who we lose touch with throughout the year. So I'm starting a student fellow position so that we can have a student who gets the opportunity to get mentorship and experience, and then they in return can help us to engage our members, to help us with social media, to put out regular communication, because I think we need to capitalize on the excitement that we all feel when we're here at this annual meeting and not let that dwindle throughout the year. So that's just my goal for 1 year. For 10 years, I hope that the caucus is larger and stronger, with a number of subsections, with people organized topically, with a number of strong links with other sections and caucuses. And very, very long term, I hope that we all have such a focus on the importance of family violence prevention that we don't need to talk about this anymore, because we're all so tuned into it that we no longer need a core group of committed individuals bringing our attention to this issue.
Wow. Well, thank you very much. It's been fascinating to hear about what you're doing and the important work that the caucus is pursuing.
Thank you so much for the opportunity.
Thank you.